Did you know that 75% of Medicare beneficiaries are on the wrong prescription drug plan? They either shop by brand, shop by premium, or just make assumptions about their plan. Hey, welcome to Understanding Medicare. We're going to talk today about how Part D prescription drug plans work. We'll talk about formularies, we'll talk about the stages that you can go through, even that famous donut hole, or infamous, I should say. And we'll even talk about pharmacy networks and how to choose the right plan so that you can save the most money. Hey, I'm Randy Bond. This is Understanding Medicare, and we're going to talk prescription drug coverage right now. One of the biggest concerns that seniors have is, how do I pay for my medications? That's where Medicare Part D comes in. This is a prescription drug plan. And prescription drug plans are very simple in the sense that all that they do is help to cover medications whenever you're getting them from a pharmacy. However, there's some complexities to it, and that's what we're going to walk through here so that you have a good understanding of how Part D prescription plans work. First thing to know is that Part D plans are only offered through private health insurance companies. You can't get Part D coverage directly through Medicare. The second thing to know is that you can get your Part D coverage either as a standalone prescription drug plan to go alongside your original Medicare and a Medicare supplement, or you can get it included as a part of your Medicare Part C or Medicare Advantage plan. Those are two different ways of getting your Medicare, and we'll talk about more about Part C plans in an upcoming episode. But for now, just understand that you probably want to have Part D coverage. Every senior at some point or another typically has some kind of medication needs. You may be there right now, and we're going to talk about how the plans work and how to choose the right plan for your situation. The first thing to know about a Part D plan is that there are no plans that cover every single medication. However, every plan must cover at least 2 medications in every therapeutic class. That means that if you get a plan and then sometime during the upcoming year, your doctor diagnoses you with some new condition, there's at least 2 medications that you and your doctor can choose from in order to get your treatment at least for the rest of that year. So just understand Medicare has built in that you can get the kind of help that you need when you need it. Every plan has what they call a formulary. Now, that's a big word, but it just simply means it's the list of the medications that they cover, and every formulary is typically set up in a tiered formulary. So you probably have heard of like a tier 2 medication or tier 3 medication. It's actually the plans that set the tier. It's not Medicare. It's not the drug manufacturer. It's not the pharmacies that set the tier. So a medication is not universally tiered on every single plan. They can vary from plan to plan, and that can make a big difference on how much you're paying for the medication. So typically, your tier 1 and 2 medications are your generic medications. Tier 1 are the preferred generics. Tier 2 are the other generics. Tier 3 are your name brand medications. So if you're seeing advertisements for it on television, it's probably a tier 3 or higher medication. Now just understand there can be some generics that are tier 3. Tier 4 are other brand name medications, but they're the non-preferred brand name drugs. Tier 5 is usually your specialty meds. And those can be a much higher cost, and you typically pay a percentage of the retail price of a specialty med tier 5 type medication. Generally, the lower the tier, the lower the cost for you. That's why it's important to try to select a plan that has your medication at the lowest tiers and the lowest cost. We'll talk about choosing a plan a little bit later on, but I just want you to have that in mind as we begin. The second thing to know about drug plans is that every single drug plan is going to operate the same way. Your prices will fluctuate, or will likely fluctuate if you're taking some expensive medications or if you're taking a lot of medications. Medicare has set up that every drug plan goes through 4 distinct phases or stages. The first of those, and this is kind of an optional stage, is the deductible stage. During the deductible, you pay the full price of the medication. It feels like you don't have any coverage at that point at all. And again, remember, coverage doesn't mean we pay 100% of the cost. It means these are the medicines in this case that we will help you pay for. And so during the deductible phase, you pay the pharmacy counter the full price of the medication. A deductible is not an extra fee that you pay. It just means that you're paying the full price as though you had no insurance during that stage. Medicare sets the maximum deductible at $445. Now, not every plan has a deductible. So if your plan does not have a deductible, or once you have met your deductible, that's when you move to the next stage. The next stage is what is known as the initial coverage stage. This is where you're going to pay a set copay based on the price of your medication. So your plan may have set up that if you're taking a Tier 1 medication, a 30-day supply could be $3. And this is just kind of a ballpark to give you an idea. And it's not intended to reflect any plans that are out there, but just to kind of give you an idea. Your plan may also call that if you're taking a Tier 2 medication, a 30-day supply might be $10. If you're taking a Tier 3 medication, you could be paying $45 for that same 30-day supply. And a Tier 4 might be $90 or $100, depending on what your plan says. And then if you're taking a Tier 5, you might pay 25 or 33% of the retail price of the medication. The retail price is something that is very important. Every plan has a different negotiated retail price with every single pharmacy in the country. And so what that means is that how much you are paying is not necessarily what Medicare is looking at in order to move you to the next stage. What they're looking at is the retail cost. This is very important. Once all of your retail prices together add up to $4,130, again, this is not what you've actually paid at the pharmacy counter, but what the retail price behind all of that is. Once you've reached that amount, that's when you're going to move to the next stage. The next stage is known as the coverage gap. More people know it as the donut hole. Again, this is where your prices could change to where you are paying 25% of the retail price of the medication. So let me give you an example here. Let's say you're taking insulin, and the insulin has an $800 retail price on that. When you're in the initial coverage phase, you might pay $45 for that insulin. However, once you move to the coverage gap or the donut hole, you'd pay 25% of that $800, which would be $200. So you could see that, again, go up and down throughout the year, and you just need to be aware of that. And anyone who is a good agent is going to help you to know that in advance. So we take a look at your medications, if you allow us, and we can plug that in, and Medicare can tell us precisely which plan is going to have the lowest cost based on your medications, and it's going to let us know when you're going to hit the stages. The stages that you go through are not based on the calendar. So you don't hit the donut hole simply because it's July. You hit the donut hole because your retail price, in this case of like the insulin, 5 months at $800 a month, and assuming you've got a couple of other generic medications or something that you're taking in there, that means that by end of May, early June, you could be in the donut hole and paying a little bit higher on that insulin. If you've got a lot of expensive medications, once your total out-of-pocket cost reaches $6,550, that's when you would go into the final stage, and you would stay there for the rest of the year. During that stage, you're going to pay the greater of 5% of the retail cost of the medication, or if it's a name brand, $9.20, or generic, $3.70. Again, whichever the higher amount is, and you'll pay that for the rest of the year. Then on January 1st, everything resets back to zero, and you start the process all over again. So let me just kind of give you an example again, is that if you got that expensive kind of medication like insulin, you'll pay the full price of that up to that deductible amount. So let's say January, you do have a deductible, you could be paying that full price for that medication. And then once you get into the next month, because you met the deductible, if that was a very expensive, some people, it takes them a couple of months to reach the deductible. And then you move into the initial coverage phase. You may pay for that insulin, if that's a Tier 3 medication, $45. You hit the donut hole, now you're paying $200 for that 25% of the $800 retail price of that insulin. And again, the insulin price, the retail price is different based on the plan that you're in. And then finally, if you reach the catastrophic coverage, then you would pay the 5% of that $800 drug, which would be $40. So your medication went from high to more manageable to kind of high again to a little bit more manageable if you go through all 4 of those stages. So key takeaway from this is, number one, you can't guess at what that would be. We have the ability as Medicare agents to let you know exactly what your cost would be based on the medications that you're taking right now. We can also let you know if you're going to hit the donut hole. Not everyone does. Most of my clients are generally in the deductible phase or the initial coverage phase throughout the year. Quite a few, but not all, hit the donut hole, and a very few do hit the catastrophic coverage. But that is going to be vary based on your situation, and just be aware your costs are going to vary. One of the things that we can do is we can look at different plans to kind of help you manage your cost. We may look at a plan that does not have a deductible so that you don't have a painful January, and that could equal out to more stable payments throughout the year and maybe some lower out-of-pocket costs for you. But that's where a good agent can kind of help you find the right plan and help you to plan accordingly. Now, if medication costs are a concern for you because you are in a lower income bracket, I do want you to know there is a program offered by Social Security known as Low Income Subsidy or Extra Help. Both of those are just 2 different terms for the exact same program. This is for lower income individuals and couples that might, as an individual, receive $1,600 or less in total income, or as a married couple, around $2,000 or less as a married couple filing jointly. And then your assets need to be a little bit lower, so about $19,000 if you're a single person. And as a married couple, your assets would need to be below $26,000. If that sounds like you, give us a call and we can help you get that started, or you can go to the website right here and fill out that application on your own. If you qualify for this program, it will help pay for your Medicare, your Part D premiums, and it could help pay for your medications. If you receive the full Extra Help amount, that means that the most that you would pay in 2021 for a name brand medication is $9.20, and the most that you'd pay for generic medication is $3.70. And there are no donut holes with Extra Help individuals. So if you are in a position where you feel like I have to choose between my groceries or my medications, you might want to look and see if you qualify for that. If you have specific questions, please give us a call or contact Social Security, and they would be glad to help you out as well. But that is a program that a lot of people really need to know is out there, because that can make a big difference in your life. Let's also talk a couple of other features about Part D plans. Part D plans do have pharmacy networks. So it may be that your plan has a network of pharmacies that's split up between preferred pharmacies and standard pharmacies. You'd pay a lower cost if your pharmacy is in their preferred network. You might pay a higher cost if it's in a standard pharmacy network. If your pharmacy is not in the network and you sign up for a plan, you get to pay the full price of your medication. This is why it's important to start with your medications rather than starting with the company. One of the biggest mistakes that people make is shopping for a Part D plan by brand. So they just assume that all of my medications would be covered. They assume that my pharmacy is going to be covered, and you wind up paying way more than what you should. Medicare did a study and found that something in the neighborhood of 80% of all Medicare beneficiaries were in the wrong Part D plan. What that means is that if they were in a different Part D plan, they would save on their prescription costs. They would pay less. And so what we try to do is we start with the medications that you're taking and look at the pharmacy that you use to find the right plan that's going to fit that situation, rather than starting with the plan and hoping that your pharmacy and medications will fit within that plan. So don't shop by brand. And don't shop by premium. Some people assume that if I pay a higher premium that all of my medications are going to be covered and I'll pay the least amount, or my pharmacy will be in the network. Any number of these different things that are assumptions. You don't necessarily have to pay the most expensive premium to get the best coverage for your situation. Sometimes paying a low premium can also mean that you're paying the lowest possible price that you could for your medications. So again, start with the medications and move from there. Now, there are a few things to be aware of on a Part D plan. Number one, your plan may have step therapy. In fact, all of them really will. And this is where if your doctor prescribes you a name brand drug where there is a generic that is available, the insurance company is going to insist that you take the generic first. This is intended to save you money and, quite frankly, to save them some money as well. However, if your doctor has already tried that with you, you can skip the step therapy. Or if you try the generic and it's not working, then you can take the brand name drug and they would cover that for you. And that would not be a problem. So take something, for instance, like the thyroid medication. Some people can take the levothyroxine, the generic form. But some people, because the formulation is just a little bit off, can't take the levothyroxine and they have to take the Synthroid. So that's just kind of an example to let you know how the step therapy would work. There may be quantity limits. So that would be something to be aware of when we're looking for the right plan for you, to make sure that how much your doctor is actually prescribing and what you need to take is within the limits of what your drug may have or your drug plan may have on that particular medication. Some medications are a little riskier. Some have different kind of costs associated with them. And the drug company wants, or the drug plan wants to make sure that you're not getting over-medicated or that it is in your best interest. So they may have limits on that. And we want to make sure that if you're taking 60 of a particular medication in a month, that your plan doesn't limit you to 30 in a month. That can run into some pitfalls if you're not careful. Plans may also require prior authorizations. There are some medications, and this is not on every medication, but if your doctor prescribes you one, the plan may need you to get authorization from them to make sure that you're taking it for what the drug was originally intended for. And so this is something that, again, your doctor's office would work through on getting that. That's not necessarily something that you do, but you may need to let them know that they need to do that. So it could be that you show up at the pharmacy counter and the pharmacist tells you, hey, you're going to have prior authorization. You just simply pull out your cell phone, call the nurse at the doctor's office, let them know. They'll work through the rest for you. Now, there are some good things to know about. There's a couple of different exceptions that you may want to be aware of. One of them is a formulary exception. If your doctor prescribes you a medication that's not covered on the plan that you currently have, you can have the doctor's office ask for a formulary exception. They'll let you know in 72 hours. And if they say yes, then the plan is going to cover that medication for the rest of the year as though it had always been on their formulary. Now, going into those subsequent years, we'll probably need to find you a plan that already covers that, but at least for the rest of the year, you'd be covered. The second is what is known as a tiering exception. Remember the drug tiers, tier 2 and so forth? Sometimes if your doctor will ask for a tiering exception, the drug plan may lower the tier that a medication is in so that you might be able to afford that. A little bit rare to have that approved, but that is something to be aware of that is available in every single prescription drug plan. When can you get signed up for a Part D drug plan? Well, for most people, you're signing up for a drug plan as soon as you're turning 65 and you're retiring. You have your initial enrollment period, which is the same as your Medicare initial enrollment period. So that's the month that you're turning 65, the 3 months before, and the 3 months after that. So if your birthday is in July, you have from April 1st to October 31st in order to get signed up for your prescription drug plan. However, if you're still working, you've got some creditable drug coverage with your group plan, you can put that off if you can. But again, ask your benefit administrator, is my prescription coverage and my health plan considered to be creditable coverage for Medicare? If your benefit administrator tells you it is, then you can put off signing up for your Part D plan until you are retiring. And then when you retire, you have a special enrollment period. You have 63 days that you can sign up for Medicare, sign up for a Medicare Part D drug plan, get your Medicare supplement, or to get a Medicare Part C Medicare Advantage plan. Both of those mean the same thing. Usually those would have your Part D coverage all built into that. So you've got that 63-day window. And what I would recommend is that you get all that lined up so that your coverage goes into effect as soon as your group plan is ending, so you don't have any kind of gap in coverage. So you can work in advance, but just understand you have 63 days after the date that your coverage ends with your job in order to get signed up for your Medicare Part D, Medicare supplement, and all of those things. Something to be quite aware of is that Part D can have a penalty. So if you don't sign up for a Part D plan when you're first eligible to, and you sign up at a later date, you would have a penalty that is 1% for every month that you were not in a Part D plan from the moment that you turned 65 until you sign up for one. So don't do like one individual that I know that they turned 65, they weren't taking any medications, they didn't have any group coverage, but they didn't feel like that would be a good way to spend their money on that monthly premium. And then 10 years later, they called and said, hey, I've got these expensive medications. How much would a Part D plan be for me? Well, the Part D plan was only $20 a month. However, that was 10 years times 12 months. 120 months is 120%. That was added on to that premium, which was roughly $50 a month for her. So that would have been $70 a month. And that $50, that penalty, will follow her for the rest of her life. And so we want to avoid that Part D penalty. There are low-cost Part D plans in most parts of the country. And so go ahead and if you're turning 65, you're not taking any medications, go ahead and get signed up for a Part D plan. And if you're getting it with a Medicare Advantage plan, that's usually included in the premium on the Medicare Advantage plan. And some Medicare Advantage plans, depending on your area, may not have any premium at all. So you can very easily avoid a Part D penalty. And we would like you to. There's no need to pay Medicare any more than what we need to. Let me give you some tips for choosing the right plan. Number one, start with your medications. Don't start with the company. Don't start with the premium. Start with what you're taking. And again, utilize someone like me. We do this all the time. We know the ins and outs on all the plans, and we're glad to help you. And there's never, ever any cost or charge for our services. You want to see which plan is going to have the lowest annual cost for your medications. The medication cost, the retail price is different on every plan. The tiering is different on every plan. And so we want to make sure that the bottom line, what you're paying at the pharmacy counter, plus what you're paying in that monthly premium, is going to be the lowest for you. We understand medication costs can be one of the biggest ongoing costs that seniors have. And we want to try to save you as much as we can. Number three, buying by brand is no guarantee that it's going to be the right fit for you. And buying by premium is not necessarily going to be the right strategy. So don't just simply look at the highest premium and assume that you have the highest level of coverage for your situation. Could be that you can get away with the lowest premium and still have the lowest cost for you. Take advantage of the annual enrollment period. You have your initial enrollment period that you can get signed up for a Part D plan, but never ever get married to your Part D plan. Two things can happen during the course of the year. One, your doctor can prescribe you a new medication, and that could throw the whole equation off. And number two, and this is really important because this is the kind of the blindsided sort of thing that can happen to you, is that every year, the Medicare gives plans an opportunity to change their formulary. Now, they can't change within the year, but for the upcoming year, they can tweak their formulary in order to make adjustments as they see fit. That means that they could raise the tier on your medication, or they can stop covering your medication altogether. And again, this would take effect for January 1. So if you're in a drug plan, Medicare gives you an opportunity every October 15th to December 7th, that's your annual enrollment period, in order to review your prescription drug plan and see if it's still going to be the right fit for you for the upcoming year. And so we want to take a look and make sure that your plan is still going to cover all your medications and another plan is not going to cover them better. If there is another plan that would cover them better, it's easy to change. There are no health questions, and you can change your drug plan every single year. Now, understand, Drug plans do not reward you for loyalty. So sticking around with the same drug company isn't going to save you any money, isn't going to get you any bonuses or rewards. And number two, drug plans are not going to get angry with you if you leave them 1 year and then come back another year. They're not going to give you a hard time. They're not going to call you and say, oh, what'd you leave us for? They're going to treat you as though you had been with them for years and years. Let me give you an example from my dad. My dad had gotten a new prescription, and I knew that had happened. We had talked about it. When the annual enrollment period came around, I said, hey, Dad, let's take a look and see if there might be another plan that would be better for you. Oh, no, he said. I've been with the same company for 10 years, and they've treated me great. And I was like, well, I understand that, and I'm so glad that they've been good to you, but let's just take a look for giggles and grins. Well, I'm glad that we did, because that one medication, it was going to cost him an extra $1,000 per year on that same drug plan by simply switching him to a different card that he would take to the pharmacy counter, and by paying about the same premium, I think it was actually $1 less per month, he was going to save $1,000 a year on that one medication. And so we want to make sure that you are saving as much as possible. Don't buy the brand, don't buy by the premium. Buy according to what you have right now for the upcoming year. And that's going to save you the most year by year. And if you'll take advantage of that annual enrollment period each year, you will save as much as you can on your prescription drug cost. Hey, I know that was a lot of information. The Part D plans are simple. They just cover medication, but they have some complexities there. And the general information can be overwhelming. But when we do a one-on-one consultation with you, it'll make a lot more sense because we'll have real numbers for your situation. So if you don't mind sharing your medications, want to do a free, no obligation look at that. There's never any cost to use our services at any point along the way. We'd be glad to take a look at your medications and see which plan would be the right fit for your situation for the upcoming year. You can give us a call or you can visit us online here, fill out one of the forms, send that in to us, and we'd be glad to help you out. We're so glad that you joined us today. If you do have questions, please call us, contact us. We'll be glad to help you. Join us for our next section as we are talking about Medicare Advantage plans. That's that Part C that we've been talking about. Hey, thanks for watching. We'll see you next time.